Hello, Dr. Natarajan here again. So we'll talk about post-eye surgery during the COVID time, what you have to do. For example, in case you have undergone surgery in the third week of March, either a cataract surgery or a retina surgery, what you should do during COVID. And I think every eye hospital has started telemedicine or a telephone consultation or WhatsApp consultation, what we call. And some hospitals have got platforms of teleophthalmology, like Aditya Jyoti Hospital, Arvind Eye Hospital, LV Prasad, then Shankar Netralaya, and individual doctors are doing it with the phone or WhatsApp photos. So what you have to do is, one, you can take a photograph, ask somebody to take your photograph of your eye with well focused, so that you can see the front of the eye properly, and then also you can report whether you have, how is your vision and how you feel about it, so that the operating doctor can guide you further. Routinely at Aditya Jyoti, from the date of surgery, we advise not to splash water on the face, and we can advise them to take head bath, that is from backwards, so that you put the water behind, so that you don't put it on the face directly, and you can take bath below the neck and wash your hair from behind, like a 5-star sterility, where you wash your hands and make sure you put the drops after washing your hands with soap and water. And in the COVID time, you have to wash for 20 to 30 seconds with the soap, so that every time you put 4 times a day, depending on what your respective eye doctors have prescribed. And I also suggest not to do violent exercise. You can do simple walking, and don't do any exercise where the head goes down, so that it is like sudden bending down. You should avoid. And I think other than that, you can be normal. You can watch television, read, but I think sometimes it can strain. So you can give rest to the eye and then follow your activity. And usually you have to use the drops for 1 month for some patients and 6 weeks for some patients. And I think you have to get your advice from the hospital where you are operated. And I think you should, if you have any doubt, you should communicate with the hospital. And I'm sure all hospitals have the emergency numbers available. Even the nurse can help you, or the reception in the hospital can help you. So please talk. And any new symptom, I think the government is allowing for any emergency to go to the hospital. And I think if there's any real emergency, you have to talk to your doctor and get your eyes examined with all the precaution, no crowding, physical distancing, and make sure you don't take too many relatives to the hospital. So the idea is to cooperate with each other, so that we have to contain this coronavirus. And I think definitely, in case you have doubt, don't do any search in the internet and then interpret your symptom or complaint. Kindly talk to your eye doctor who was operated. So that is important, because rarely some emergencies can be there which should not be missed. So I suggest, if you have undergone eye surgery, minimum care should be taken for 1 month, and then some retina patients we advise for 6 weeks. But routine follow-up for post-surgery, for a checkup of glasses, for checkup of the routine, I think you should avoid for till the time the May 3rd opens. And I think again, hospitals are deciding. We had a webinar in our All India Eye Doctor Society that we decided that even after the COVID opens, I think we'll have the staggering appointment. That means we suggest 4 appointments per doctor or per optometrist every hour, so that you don't crowd. And we also, hospital may have to work extra hours. So I think you have to cooperate with the hospital, so that you be in contact with people very minimal. So even after the COVID break is over, so that you have to make sure this pandemic of coronavirus is ended. And be safe, be healthy, be happy.